To protect you and your family, the Portland Water Bureau has worked closely with Oregon OSHA to develop a streamlined set of standard operating procedures for working with asbestos cement pipe. This video will show you why these work practices and personal protective equipment are so important and demonstrate their practical use in the water industry. It's tempting to believe that exposure to the amounts of asbestos released when working with AC pipe is not a danger. But even the smallest exposure to asbestos can have grave consequences for you or your family.
The diseases most commonly associated with asbestos exposure include asbestosis, asbestos-related lung cancer, and malignant mesothelioma. These diseases are all characterized by a long time interval, often decades, between the asbestos exposure and the disease diagnosis. Asbestosis is a progressive form of fibrosis or scarring of the lung tissue in individuals with prior asbestos exposure. The scar tissue stiffens and distorts the lung, leading eventually to the primary symptom of shortness of breath. Breathing tests will often show reduced lung volumes, and chest X-ray or CT scan will show opacities or areas of fibrosis in the lung. There is no cure for asbestosis, and care is mostly supportive, including elimination of any potential further exposures and, if present, the discontinuation of all smoking. Lung cancer is another asbestos-related disease. Very often, asbestos-related lung cancer is found in individuals also suffering from asbestosis. Smokers with asbestos exposure are at a particularly high risk for lung cancer, having more than 50 times the risk for lung cancer versus non-smoking, non-asbestos exposed individuals. Asbestos-exposed patients with shortness of breath, chest pain, persistent cough or weight loss can be evaluated for lung cancer with the appropriate X-ray, scan, or other diagnostic test. Treatment options will depend, in part, on the extent of the tumor at the time of diagnosis. Finally, malignant mesothelioma is a cancer in asbestos-exposed individuals arising from the outer surface of the lung, or pleura, or from the lining of the abdominal cavity. The time frame from asbestos exposure to diagnosis is particularly long for mesothelioma, often 20 to 40 years. Symptoms of mesothelioma may include shortness of breath, chest or abdominal pain, and weight loss. Diagnostic evaluations often include CT and other scans and eventual tissue biopsy for definitive diagnosis. Treatment options such as chemotherapy, radiation, and surgery do exist, although at this time there is no cure for mesothelioma.
To minimize the risk of these dire effects on your health and simplify the process of working with asbestos-laden concrete pipe, the Portland Water Bureau and Oregon OSHA have signed a letter of agreement defining a set of streamlined safety practices for working with AC pipe. This is a common-sense, cooperative agreement that allows crews to avoid air monitoring and time-consuming, more cumbersome asbestos abatement techniques. These procedures apply to water utilities who have signed the letter of agreement and are on record with Oregon OSHA. The primary emphasis of the procedures is on using wet methods and avoiding power tools, sanding, grinding, chipping, or any method that causes pipe to shatter, crumble, or be pulverized.
One of the advantages of a video like this and of the training materials of which it's a part is that it represents really the best opportunity to advance safety and health. Oregon OSHA is always pleased when we can work with organizations like the Portland Water Bureau and the American Water Works Association in pursuit of a common goal to protect workers from hazards in the workplace, in this case asbestos, and to do that when possible in a way that minimizes the regulatory burden. The training outlined in this package does exactly that. It allows employers and their workers to comply with the standards, to do so in a way that is simple and straightforward, and that minimizes the regulatory obligations, but that does all that without compromising worker protection. And that really is the best of all possible worlds, and it's why we at Oregon OSHA were pleased to be part of this project.
To illustrate the standard operating procedures in action, we observed a tie-in project between an existing 10-inch asbestos cement pipe and new water main. Compliance with the letter of agreement requires that before work begins, all personnel on a job like this must have at least a minimum level of training in accordance with Class 3 asbestos work.
Are we going to need respirators?
Well, using the wet methods, asbestos particles, the fibers, don't become friable. In other words, they don't come out into the atmosphere where it becomes a respiratory hazard. So by keeping it wet, we don't need the respiratory protection.
Once the pipe has been exposed, water shutdown completed, and shoring installed around the work area, the operation began with a pre-work orientation meeting. This briefing is an important review to ensure all workers involved in the project understand the standard operating procedures.
We're going to do this asbestos cement pipe job this morning. As we talked earlier, we're going to cut that pipe and you're going to sleeve on another piece. So Doug's the crew leader. We've got the...
After the whole crew is met, the designated competent person on the project and crew review and sign the Safe Work Procedure Checklist. The Safe Work Procedure Checklist includes identifying potential AC pipework needs prior to beginning project, ensuring the crew has been asbestos awareness trained, assembling the required personal protective equipment, including disposable Tyvek coveralls appropriate for the hazard, or rain gear that can be properly decontaminated, rubber boots, rubber gloves, and safety glasses. Extensive historical industrial hygiene sampling has shown that when using the standard operating procedures presented in this video, respirators are not required. The Safe Work Procedure Checklist also requires that pipe tools are clean, in good working order, and the necessary control equipment be readily available, including garden sprayer with adequate supply of water, large wipes for cleaning tools and equipment, asbestos disposal bags, duct tape, waterless hand cleaners, warning signs, barrier warning tape. Once the checklist is complete, crew who will be working directly with the asbestos concrete pipe don their personal protective equipment. This process begins by stepping into the high-top rubber boots, then putting on full-length coveralls, followed by rubber gloves with 1 to 1.5 inch cuffs, and then sealing the gloves and boots to the coveralls using duct tape. Crew members should assist each other with sealing, and it's helpful to leave a tab at the end of the tape seal to make it easier to remove. Before any work is begun involving the asbestos concrete pipe, a controlled access zone, or hot zone, must be created around the work area. To comply with the standard operating procedures, establish a perimeter 5 to 10 feet back from the leading edge of any excavation or confined space. Set cones or barricades strategically around the perimeter. Thread warning tape around the perimeter and attach to cones or barricades. Set authorized personnel-only signs around the outside of the zone. Allow only authorized and properly outfitted personnel to enter the zone. Any person or any equipment leaving the controlled access zone must be subjected to decontamination procedures that will be described later in this video. With the controlled access zone established, designated crew are now ready to perform the job. In this case, the project is to remove a section of AC pipe, install a cap at one end of the cut, and a 45-degree bend at the other. A short section of new pipe will then be attached to the bend to tie into an existing section of ductile iron water main. 3 crew members have donned the appropriate personal protective equipment and entered the control zone to do the work. 2 descend into the trench via a ladder, and the 3rd remains topside, but within the controlled zone, to assist the workers below with tools and materials, or to join them in the trench and lend a hand if necessary. Other workers assist from outside the controlled zone, preparing fittings, retrieving tools, setting pumps, or other tasks. They can convey tools or materials into the controlled zone during the project, but no tools or materials may be removed from the controlled zone without undergoing the decontamination process. In the trench, the 2 workers begin the process of cutting the asbestos concrete pipe. They adhere to the critical wet method standard by continually spraying water onto the pipe and tools as work is conducted. This is done with a simple pump-action garden sprayer. Soaking the pipe and tools during any work that may disturb the asbestos prevents fibers from becoming airborne and being inhaled or settling on workers' bodies and clothing. Also essential for adherence to the standard operating procedure is using only approved hand tools. In this case, the job was done efficiently using approved hand tools, including a bristle brush, a roll cutter, a handsaw, a cold chisel and hammer to remove an existing joint, and using manual wrenches to tighten bolts on new fittings, positioning and tightening bolts over new cast iron pipe rather than the asbestos concrete pipe, eliminating the risk of disturbing asbestos fibers. Additional hand tools approved for working with AC pipe within the standard include snap cutters and wet tapping equipment, with precautions taken to prevent water contamination. If it is determined that power tools must be used, these streamlined work practices will no longer be acceptable. More elaborate asbestos abatement methods, including full containment, respirators, and air monitoring, will be required. When the work involving AC pipe is complete, there are still a few important steps to ensure that no asbestos fibers leave the controlled zone and possibly go home with you on your clothes or skin.
It's important that asbestos workers undergo the proper decontamination procedures at the end of their workday. Asbestos fibers can adhere to clothing, and unknowingly, asbestos workers can expose family members to harmful levels of asbestos.
Working within the controlled zone, all tools that were used within the zone must be decontaminated by thorough spraying with potable water and wiping with disposable towels. Runoff water from this process must be captured in a yellow asbestos disposal bag, along with the disposable wipes used to clean the tools. Asbestos concrete pipe that was removed from the job must also be decontaminated, double bagged, sealed, and labeled using this method. Once all tools, pipe, and material from the hot zone have been processed, the crew begins their personal decontamination. Remaining within the zone, workers stand inside an asbestos disposal bag as their personal protective equipment is sprayed thoroughly and removed. The yellow asbestos disposal bag is sealed, placed inside a second clear bag, which is also thoroughly sealed, clearly indicating the material has been double bagged as required for proper disposal. Personal decontamination is completed by cleansing hands and face with waterless cleaner. The bags are then available for removal from the controlled zone for final disposal. With decontamination finished, the controlled zone barriers and warning tape can be removed, making the site available to all workers involved in completing the job.
So how did the job go?
At a convenient time soon after the project is done, it's beneficial for the crew leader to discuss how the job went in regards to adherence to the operating procedures.
Everything's in the green shed, paperwork's turned in. Pretty easy job.
Oh, good job.
Thank you.
Ultimately, the decision to follow these safe and simple work practices is a matter of your personal responsibility. As a water utility professional, you are accountable for understanding and following these procedures, and you can face disciplinary action if you do not. But the bottom line is, it's the right thing to do for the protection of your coworkers, yourself, and your family. Thank you for your time and attention.